I am Luciano Stumbo. I am an oncologist and I work in University Hospital Campus Bio-Medico of Rome. And for the IUCS, I presented an abstract for the poster regarding a case of brain metastasis development despite PSA suppression in an hormone-sensitive metastatic prostate cancer patient under apalutamide treatment. This case report is important to us to show that even if prostate cancer is the most common tumor in older men and the most prevalent sites of metastasis are usually bone and lymph nodes, here we notice that there is a brain involvement. Statistically, brain involvement of secondary lesions in prostate cancer is 1–2% of patients, and usually is above all in metastatic castration-resistant patient. And the second generation androgen receptor signaling inhibitors, HARSI, nowadays are the standard of care for lots of these patients, but they have a problem because they can't easily penetrate the blood-brain barrier, and so they are usually excluded from central nervous system. With this background, we show the case report of a young man with a metastatic hormone-sensitive prostate cancer who developed brain metastasis under apalutamide treatment, started 15 months before, but with an undetectable PSA value. Patient presented with a rapid worsening of symptoms that lead him to perform a brain MRI showing the presence of multiple brain metastases. And in all this period, PSA was persistently undetectable, and the condition of this patient were getting worse and worse in 15 days, leading him to death and granting him just best supportive care. Despite the fact that brain metastases are quite rare in most of patients with prostate cancer, this case invite us to perform a brain detection, a brain imaging, above all in patients treated with RC or chemotherapy, just because of this low penetration of brain barrier. And in conclusion, what tell us this case report? This case report is inviting us to perform an MRI detection or imaging also in patients with prostate cancer, in which we usually perform just PET-CT or CT scan that aren't so sensitive to show this localization. And mainly we should perform also for young patients the BRCA mutation status, because this patient we know that have a more aggressive disease and can develop metastasis also in brain usually. This case report is just the way to investigate more and take in attention also this kind of disease, and above all in young men. And we need further investigation, and maybe not just a case, but of more cases in multiple centers to stress the attention on this topic. Thank you.